Hello, welcome back to the David Watson podcast. Today I spoke with Dr. Peter Kowey, and we spoke about his new book, Failure to Treat: How a Broken Healthcare System Puts Patients and Practitioners at Risk. And predominantly we spoke about the healthcare in America, where it's gone wrong and why. Hello, welcome to the David Watson podcast. Thank you very much for coming on. How are you doing?
I'm doing well, David. Thanks for the invitation.
Oh, you're very welcome. You're very welcome. Now, for someone like me who's in the UK, we don't really have a good grasp of how the American medical system works. And in some respects, it's kind of the closest I can, and I say this up front, saying I don't know how the American medical system works, so this could be a really bad analogy. But if I go outside of the UK and I go to another country, I have to buy medical insurance in case something happens to me. That's about as close as I understand how America works. So, and that's probably, crayons compared to computers, if that makes sense, in terms of an understanding. So how does it work in America? Because, just how does the medical system work? How do you get medical care there?
Well, I guess the first thing that comes to mind is that it doesn't work. It's a broken system. And the reason it's broken is because we have patchworked our system of medical care coverage for our public, our patients, from several different sources. So we have the elderly who can access Medicare, which is free care through, quote unquote, free care through Medicare. We've had Medicaid, which is also a government subsidized insurance for the indigent, so below a certain income level. And then we've traditionally had healthcare coverage provided by employers who purchase healthcare coverage from insurance companies for their employees. That doesn't work quite as well anymore because the costs are staggering. And then finally, we have people who can buy health insurance on their own, which is extraordinarily expensive, but has been subsidized with the so-called Obamacare. Obamacare meant that people who wanted to buy their own insurance could do so through exchanges with subsidies from the federal government. And a very large percentage of people took advantage of that opportunity and have had so-called Obamacare for the last, say, 5 to 10 years.
So when I look at the UK, say, it's the National Health Service that we have, that started in 1953, I think it was, and that effectively was free medical care, in the sense that if you could go to a doctor and if there was a problem you could go to the hospital. It's kind of expanded beyond its original intention, if that makes sense. As medicine improved, these things become quite nuanced, and now it covers a whole range of healthcare. One of the big debates is some of the things it covers actually healthcare, or is this something people should pay for themselves? So where does, with regards to the United States of America, where was it that they never entered into a kind of a national health service? Because in some format, it's mostly around most countries in Europe and stuff like that. That it's kind of just.
So there's lots of reasons, potential reasons, but the core reason was because medical insurance companies make a lot of money, and they have a very strong lobby. And they have opposed the idea of national health care, largely because obviously that would put many of them out of business. And so we've never been able to get our legislators to seriously consider it. And the retaliation has been that is so the pejorative term that's used is socialized medicine. That's socialism, that's communism, right? All those bad words are associated. It's woke, whatever the hell that is. And so there's been a very strong opposition to the idea of providing care for everybody. So take it, despite that, Lyndon Johnson, because of his powerful effect on Congress and his compelling ability to get legislation through the government, did get Medicare for us. And Medicare was a revelation and a revolution because it did provide free care. But remember that Medicare, as a compromise to the powerful insurance companies, does not cover everything for the seniors. It covers 80% of their health care. 20% still needs to be provided by some other source, like a private insurance company. That was the compromise to get Medicare enacted. What it's created is a bewildering system for seniors to get medical care. They just recently polled a couple thousand people with Medicare and asked them if they thought that they were able to get their medical care easily. And almost everybody said they found it extremely confusing and difficult. And that's because they have various ways of trying to fund the 20% that's not covered by Medicare. What's happened is the insurance companies came up with the idea of Medicare Advantage, which you may have heard of. And what that means is that the insurance company can collect the Medicare the money from the government on your behalf and then insure you for the rest. So in essence, you are a client of the insurance company and not the federal government. That allows them to carry out the same policies of denial of coverage and pre-certification and all the things that drive Americans crazy about their healthcare system now is in place for seniors as it is for everybody else. That by the way, was the thing that led to the assassination, right, of the United insurance company executive in New York, as you'll recall. It was the anger and the frustration of people dealing with health insurance companies in this country that led to the almost unthinkable reaction that people had that was what's the problem? So we got shot and killed. It was horrific. But that's why. That's how angry people are about trying to deal with our healthcare system.
I think that's a compelling point where we are in the world today is people now, I don't know whether it's blasé, I don't know if it's just plain anger and frustration, but when somebody gets gunned down in the street, probably deserved it, who cares? And you're just like, whoa, we're still talking about human lives. But then when you're talking to a mother or a father or a son who said, no, they refused a member of my family, somebody I loved, healthcare that we paid for, they refused it. They found, and you do occasionally see it's not unknown, the efforts that insurance companies will go to try and avoid paying significant costs. And the tragedy of that is not just that people aren't getting healthcare, but then when somebody does get assassinated on the street, you kind of dehumanize them, and you do think, well, you had it coming. And to put yourself in that place when you want to consider yourself a nice human being, it's a contradiction. You realize there's an hypocrisy in your own mind as to how you see human life. One of the things that, this is one of the things that where I genuinely don't know what the difference is in the UK, it's illegal to be refused treatment. So, but you can, as an individual, refuse treatment. So, but a hospital, if I effectively walked into a hospital with a gun wound, or I just, a few years ago, I sliced my leg on a roofing sheet. I ended up needing 10 stitches. It went down to the bone. I just walked straight into the A&E department, no appointments, no nothing. Got seen, got stitched up, and walked out. And my brother gave me a lift home, sort of thing. I cannot be refused treatment. we have a thing where if you are so ill or so elderly, a doctor can or a family can consent to do not resuscitate, in the idea that there's going to be no value to the life being extended. So, you know, it could be a cancer patient, it could be any of those sort of things. So, but if I don't have medical insurance in America and I walked into a hospital, am I going to be refused treatment?
No, you won't. It's illegal. There's a law called the EMTALA, which specifically states that that is illegal. It's actually very illegal. The penalties are very ponderous. But um, who pays for that? Who pays for it is the hospital. The hospital absorbs the cost. If you get admitted, and no matter how long you're in the hospital, all those charges are written off by the hospital. So last year, American hospitals rendered somewhere between 500 and 700 billion dollars of free care to patients. The quid pro quo for that, by the way, that the politicians will point out is that hospitals in this country don't pay a tax. They're tax exempt. So that
They should be.
maybe it comes out in the wash, right? That you don't pay tax, but you have to give free care. The problem here is that you can absorb a certain percentage of patients and give free care. Once that percentage gets to be higher than 10% or 15%, you're going to go back. And that's why everyone is petrified about what's happening in this country with this big, beautiful bill that Trump pushed through Congress. There are going to be massive cuts in public spending for medical care, in Medicaid and Medicare. If those cuts go into place, hospitals are going to be in dire straits. Some will close. Many will begin to operate in the red, and there'll need to be massive layoffs, and it could actually turn into a catastrophe. But that's why the Democrats in this country have dug in and said they're not going to go along with a new budget proposal because they believe that would one of the things that what they want is to have this medical care issue resolved.
It's really tricky, like I said, because I live in a country that is free healthcare. I mean, I don't know if you can see it, I've got a plaster on my arm because there's just been a couple of concerns, so I went and had blood tests today. It's just as simple as I had an appointment with a doctor. They said, let's just run some blood tests, and a week later I'm having blood tests. It's all comes out of taxes. It's whilst I cannot, for the life of me, say anything other than I'm blessed. I live in a healthcare service. We do have a huge issue with the budgets that the NHS swallows up and how they're swallowed up. There's some proper horror stories about its companies and how much money they make off the back of the NHS, how much we pay for medicines versus. So there always seems to be this issue where, and it's a horrible one because it always seems to come down to there's a lot of profit to be made from the sick and dying. But we all put a nice label on the bottle that says compassion first. And then there's some banker behind that saying, well, compassion comes at a cost. Why is it that? So we have the reverse problem of America. Our problem is the NHS has become so inflated and absorbs so much money, people are starting to resent free healthcare, or at least having to pay what we pay for it. Why is it for decades that America has resisted, because everybody in America knows how much these insurance companies make. Everybody knows how much pharmaceutical companies make. and I mean everybody. And I struggle to understand how, as a population, who have had decades to kind of just that they fight it. I mean, it just it blows my mind. But I'm not raised, because you can go back to the Kennedys, you can go back to Nixon, you can go back to Reagan. I mean, they weren't trying to sort it out. They weren't trying to get in a national health service, and I don't understand that American mentality, because everybody acknowledges it's a problem.
Well, it's bewildering, but there are ways of beginning to understand why. As you know, this country's Congress is highly influenced by lobbyists. People who want to make money and can make money have a gigantic influence on our legislators for many reasons, including obviously funding their campaigns and making sure that they get reelected, which is really their only priority, is to get back into office again. So the pressure that's exerted by private industry on Congress is immense, and that includes health insurance companies we've just been talking about, but also a very large problem in this country is private equity, because private equity now is buying up medicine in the United States. Why? Because it's a $4.5 trillion industry. We spend almost $5 trillion in this country on medical care. It's projected, by the way, by 2035 to be $9 trillion. When there's that much money on the table, everybody wants a piece of it. So the medical insurance companies are making a lot of money. By the way, what the thing that really pisses me off is they call themselves nonprofit companies, but they're socking money away into very large treasure troves. That's one problem. The other problem is the pharmaceutical industry has a tremendous lobby in this country and has been able to exert its influence on not only the legislature, but also on our executive branch, as you've seen recently. And then we also have a tremendous waste of resources in terms of the infrastructure that we've imposed. So hospital administrators in this country, we have more hospital administrators in many hospitals than we have nurses. And they make an outrageous amount of money. Here's another place where we lose money: our medical malpractice system. In this country, doctors get sued on a regular basis, and the people who defend doctors and who prosecute cases make literally billions of dollars, and suck it right out of the system. So there's all kinds of ways that we are basically squandering resources and money on a system that is overly complicated, very much overly administered. And by the way, at the same time, is burning doctors out. So not only does the system not work financially, it also doesn't work for the people who are trying to deliver medical care. It is an absolute, unbelievable, unmitigated disaster. And my book, it was an attempt to sort of point out many of these things that people are dealing with in obviously in a story form.
So when it comes to the politicians particularly, because this is, you mentioned about the Democrats are doing kicking back at the moment about these proposed changes, but when I look back, I don't know whether it's Democrat, I don't know whether it's Republic, they all seem to be powerless to do anything real, if at all they want to. It's hard to understand just how much power these companies have, because
so one would have thought that there should be some accountability for this, right? I mean, you would think that when we get to the next set of elections, that the voting public would say, you have screwed us on this issue and you did nothing to fix it. In fact, you made it much, much worse than it was before, and therefore we're not going to vote for you. The problem we have in this country is, first of all, people do not participate in the democracy. I mean, it's not unusual for elections to draw 25 to 30% of registered voters in this country.
Yeah.
Number one. Number two, people are not informed. They don't understand the issues. They watch the television commercials for politicians that tell them how wonderful they've been and how much they've done for them. And then finally, people tend to vote according to party lines. And so they don't cross over and vote for somebody on the other side of the aisle who's making sense because they've traditionally voted whatever party it is that they vote. So the electoral system of representative government in this country, unfortunately, has not responded appropriately to a legislature that is impotent, and not only impotent, but defies belief in terms of what they're doing to their public. There are a whole bunch of doctors in our Congress. Did they take the Hippocratic Oath? I mean, did they remember what the words were when they said they were going to safeguard their patients and the public? They're not doing that. They're actually putting us in tremendous jeopardy, and they're just sitting there and making their. By the way, our Congress during the government shutdown is getting paid, just so that you know that they are getting their full salaries, while the rest of the government workers are on furlough.
Well, I don't know a politician that doesn't make sure his pockets get lined. For that, I am 100%. It doesn't matter what country you're in. Their table always has food on it, and if there are any doubts, they'll make sure they go around your table first to make sure they've got some more. What is the solution?
It isn't going to be easy because, again, we have to convince a large number of people that it is the way to go. But we really do need to establish a system in this country whereby everyone can access healthcare. Now, I'm not of the belief that we can provide healthcare at this unbelievable level that we provide for our patients to everyone right now. That would take too much work, but there really isn't that much difficulty in saying that every citizen in the United States has at least basic coverage so that they can see a doctor, they can get their medicines. If they have an emergency, they have some place to go. As a society, I think, what, David, the thing that's really very maddening about this is that if you talk to most Americans, they subscribe fully to what I just said. Yeah, healthcare is not a privilege, it's a right, and that everybody in this country should have access to good healthcare. Yet, we've allowed our politicians and our leaders to sit on their hands and refuse to do anything. And one of the reasons this has happened, by the way, is that people like to call other people names.
Yeah.
So if you're in favor of doing something like this, like Bernie Sanders, who wanted to do Medicare for all, that was his pledge. He's a communist. He's a socialist. He doesn't understand. He doesn't understand what he's talking about. He's woke, whatever. And that has really grossly impeded our ability to enact meaningful legislation. But that's where it's got to be. Our professional organizations, which have been mainly impotent, our legislators, not only at the federal level, but also at the state level, need to understand that this is a high priority. And that's really the only way this is going to get fixed.
Do you see the system collapsing?
Yes. I think that if these cuts go into place, we're talking about, by the way, trimming $1 trillion from Medicaid and also cutting back on the subsidies to Obamacare, which could triple or quadruple premiums for people who have insurance on their own. If those go into place, we will have many, many fewer insured patients. Hospitals, which are already teetering on bankruptcy in this country, will go under. We'll create medical deserts. People will not be able to access medical care. Emergency room visits, which now waiting time somewhere between 2 to 4 hours, will go to 2 to 4 days. It actually has the potential, because of hospital failing with the cuts in revenue, it has the potential to be a complete and utter catastrophe.
Yeah, because I think this is where it gets difficult, because the system you described, what could happen if it implodes, like waiting times in accident and emergency, that is already happening in the UK. So you could end up, if you wouldn't, if you had a heart attack, if you had a heart attack and called an ambulance, the ambulance, although I work in care work, and the last 2 times I called an ambulance, we were advised after 3 hours it'd be probably quicker if we drive them in ourselves. So yeah. Do you know what I mean? So, and this is, and this isn't to in any way try and take away steam from your book and what you're trying to achieve, but it's just like highlighting that my NHS that's considered great, currently, there's a very good chance if you called an ambulance, it's not coming because they're so overrun. And I think for exactly the same reason that is happening in America, there is so many administrators, middle management, so many people taking money out for their own pockets that we have less people doing the work compared to the amount of people taking money out. But
absolutely,
if you went, my niece, I forgot what she did recently, but she was in A&E for 7 hours before she got seen by anybody, and that could be considered good. But I had tonsillitis a couple of weeks ago and went to the walk-in clinic in Salisbury, and I walked in and there was only one person in front of me. And when I said to the doctor, I was like, "Hey, what's this?" It was like, "This is," and he went, it was kind of a shush, don't say the word. He said, because it's either, like he said the queue, he said it's always the same. There's either nobody in the waiting room or the queue is down the road. And that's just luck. Mine was a Sunday morning. I went in at 9:10. At 10:30, I'm picking up my prescription of antibiotics from the chemist. And so, where would you, when you wrote the book, what's the book about?
So one of the things that we do in medical education that's highly effective is we tell stories. My mentor, who happened to be a Nobel laureate and a very famous cardiologist, loved storytelling. It was a very good way for him to pass information on to his patients as well as to the people, his people who were training with him. And I really felt strongly about many different elements of what's happening in healthcare, and the book goes through many of those. But I thought that rather than having some pedantic rant about how bad things are, that it would be much more instructive and educational and even a little bit entertaining for people to read stories, short stories. So there are 20 short stories. They're all true stories, anonymized true stories of things that practitioners and patients went through and suffered in our broken healthcare system. The book also contains an explanation of the cases and some commentary, but also, very importantly, some advice to patients at the end of each story about what they might be able to do to avoid some of these catastrophes that occurred. So it was a combination of trying to get people's attention, getting people to read the book, understand the book written at a level for patients so that they could understand it, but also to be positive about it. Because I agree with you, this is not a monolithic answer. I mean, we need to enact several different things. Why, for example, does the CEO of a large healthcare system in my area make $13 million a year?
Yeah.
I mean, in what universe is that reasonable when that hospital doesn't have enough nurses? I mean, there's so many things that we can enact and regulate, not to take these people lightly. They have hard jobs. They deserve to be compensated. But $13 million a year in the healthcare system. We have a malpractice attorney in Philadelphia who just endowed 2 law schools, gave $50 million of his own money to each of these law schools to have them in his name. This is a malpractice attorney. So how much money do you think this man is sucking out of the healthcare system in order to be able to do that? There are obvious ways that we can change the system, but we really have to start at the beginning.
Yeah, because I mean that's crazy, isn't it? Is because $13 million a year, and this is this thing is it's just an interesting, well, frustrating human trait that I want everyone to be healthy as long as it doesn't cost me any money. and I'm guilty of this. I can get frustrated when I see some of the people in hospital thinking, look, there's some lifestyle choices you could do that's better here. But that's not the same as when somebody has an accident. I want the ambulance to be there for them. I want the emergency operating room to be available for them. But I come in, my brain is in a frustrating, vicious circle at the moment, because all I keep coming back to is, why the bloody hell are these people able to do it? You know, it's just like you say, an attorney who specialised in suing hospitals gives away $50 million. Well, that's a problem. And like you say, you don't begrudge anyone a living, but like, like, if you've got $50 million burning a hole in your pocket that you're prepared to give it away, it's just like
it's mind numbing, isn't it?
Yeah.
So, David, we spend in this country, every person in this country, man, woman, and child, the average expenditure for their healthcare is $13,000 a year. So that comes to close to $5 trillion. Now, why can't that be enough? I mean, shouldn't that be enough money? I mean, remember, that's for people who are healthy as well as unhealthy, right? It's for children that don't even access medical care very infrequently. Well, if we're going to spend that much money per person, why in the hell don't we get better medical care out of it? Why do we have to wait 8 hours in an emergency room? Now, I agree that just putting in this system where everybody has health care, you're absolutely right, is not by itself going to make a difference unless we find some ways to control cost. Why should a drug that you're going to use for somebody who has end-stage cancer cost $50,000 or $60,000 a year when it's going to extend their life by 3 months?
Yeah.
Where is the logic? Where is the sanity? There are so many examples of things that are happening in the healthcare system that are so detrimental. And again, the book was an attempt to just begin the conversation of making people aware that we have lots of problems, but they're solvable. They are solvable if we, as a country, decide to solve them.
I just want to quickly, because you said something there about the costs of medication. So we had an interesting study, it was a couple of years ago, it came out for the NHS. And so it wouldn't be unusual if I'd gone to A&E, or if you've been discharged as a patient and you painkillers, you'd get simple paracetamol. They'd give you 48 hours of paracetamol. And one of the questions that came up is that same paracetamol I could buy from the supermarket for, I'll use dollars, say 50 cents, right? But the NHS will give it to you for free because you're being discharged. The problem is the administration cost of administering it, ordering it and getting it in would be the equivalent of about $10 for something that I can get for 50 cents on my way home from any shop, any. And you, like you say, and then there's, well, we're going to spend £60,000 on a drug that's going to extend somebody's life by 3 months. I don't want to put a value on somebody's life, but where do you have? And I think that's probably one of the big areas that enables people to not get involved in costs and numbers, because it's very easy for any administrator, lobbyist, government, so you want to put a price on human life,
right?
And as soon as you've done that, you've paralyzed me, because I don't want to put a price on human life, but there is a price that has to be paid, and somewhere we have to be able to draw a line and say, look, if and as I'm trying to figure it out and not sound like a clumsy Neanderthal, is how do you say to somebody the cost versus the life reward doesn't add up, so we don't value that life. I'm talking to, say, a member of your family, and God forbid something's happened to you, and I say, look, quality of life, maybe the amount of time he has left is this many dollars. His life isn't worth that much.
There's two issues that your very on point question brings to light. Number one, if you took that 60,000 pounds and distributed it to indigent people who have high blood pressure, which, by the way, is a killer, right, causing strokes and heart attacks, especially in our African American population, you could save about 20 times more lives than you can save by giving it to somebody with terminal cancer, right? I mean, the extension of life would be enormous. So misallocation of resources to situations where there really isn't a whole lot of hope takes the resources away from things like immunizations, prenatal care, things in the community that have a gigantic impact in terms of public health. So that's one way to look at it. The other way to look at it is that you, in your country, you do something that is extremely valuable that we don't do here. And that is, when you have a drug approved, you do a cost-benefit analysis. In the United States, there is no cost-benefit analysis. When you go to the FDA, our Food and Drug Administration, for approval, it's either approved or not approved. And then it goes on to some pricing organization like CMS. But in your country, when the drug is approved, there is a decision as to its relative value, as opposed to the drugs that are already available. And the ability to charge premium pricing or very high amounts for drugs is predicated on how valuable is this drug compared to what's already available. If we did that in this country, then there would be less of an incentive to approve drugs or to market drugs or to even investigate drugs that have a marginal effect on longevity. And we wouldn't be in this situation of having drugs that are advertised on television, by the way. That's another thing we do here that you don't do there, is that we put the ads on television so people can get all revved up about getting a drug that they think is going to prolong their life. Well, it might by a couple of months, but that's not what the advertisement says on television. It just tells you're going to live longer. It's just a completely rotten system that we have here, unfortunately.
Yeah, we have quite strict laws over here. I mean, just simple things, painkillers. You can't buy any more than 2 packets of painkillers from any shop.
Yeah.
They just don't permit it. The types of we call it over-the-counter medication. You can only get that from prescription from a doctor. A pharmacist will not give you anything without a doctor's prescription. So if you can buy it in the supermarket, you can buy it in a chemist. But if you don't have a prescription, there's the stuff that's... I just recently came back from a holiday, and I was trying to get something that in this country we call Zoplico, because I was having trouble sleeping, which when I came back the doctor prescribed for me. But I could buy that in a pharmacy in certain countries in Europe, but in the UK, right, you only get that if you've got a doctor's appointment and the doctor gives you a prescription for it. So the UK, I think, is one of the strictest countries in the world when it comes to how you get hold of medication and what you can and can't buy. And yeah, and there's no, apart from headache and indigestion tablets, nothing else is advertised.
Yeah, it's been a problem in this country. I do a lot of regulatory medicine, and there's a lot of drugs that have attempted to go over the counter, as that is, have them available generally, that are very safe medicine. The best example that I can give you is drugs for erectile dysfunction.
Yeah, which
are terribly safe drugs. They rarely cause side effects, but there's been a tremendous resistance to having those go over the counter. Why? Well, we get back to our old friend again about how much money you can charge for them. And they're enormously expensive drugs in this country by prescription, when they don't really have to be, and they could easily be over the counter. So there's always been this tension. Statins, for example, is another example. Very, very safe drugs, very effective drugs, could easily go over the counter, but again, resistance.
Yeah, I'm not sure what happens. I think there's a 25-year license law or something, because I remember for the first time a few years ago seeing Viagra available in the supermarket. but it was all previously only available on prescription. Indigestion tablets such as omeprazole or they're now available in supermarkets, and that's only the last 2 years maybe.
Yeah.
So I'm not sure what the rules are in the UK with regards to that, but there seems to be that you're only allowed to kind of have the license for it for so many years, and then it becomes available over the counter.
Yeah. Well, the ED drugs are a particularly egregious example because since they're not over the counter, the authentic drugs are not over the counter. People are getting counterfeits. Uh, people advertise on television for these drugs that or substances that don't work. There's no proof that they work, but the pool is, well, you don't have to go to your doctor to get a prescription. And men who have ED, if we're kind of getting off the point here, have ED don't want to go to their doctor. They don't want to tell their doctor that they're impotent. It's negative thing, especially for some ethnicities.
The reason I'm laughing because there's a common joke that I've discussed on the podcast before. I got into a conversation. I've had a few conversations about the menopause with menopause specialists and stuff like that, and there's this idea that men won't talk about their problems. And I said, well, when Viagra came out for men, every bloke I knew, even the ones without erectile dysfunction, was trying to get hold of it because somebody said to them, this thing will get you up for days, and like people were buying it on the black market and everything. I said, so trust me, we're not that kind of insular that we won't talk. But yeah, but back to the serious subject of the health crisis that you have in the United States. When it comes to like you say, there's not an umbrella solution because there's lobbyists, there's politicians, there's profits, equity companies, which typically are people's pension pots and everything like that. But what's the way forward to get the public actually to switch their point of view so that they kind of do understand the cost of value of life?
Well, I think that most people want to hear a message from their healthcare professional about this. One of the things that I wanted to do with the book was not just to go out to the public, but also to my colleagues and other healthcare professionals, not just physicians assistants and nurse practitioners and pharmacists and podiatrists, anybody in the healthcare field, to begin a conversation with their patients and with the public about the need to do something better for our system. And it isn't going to happen until the public is so galvanized that they're willing to petition legislators, again, not just at our federal level, but also at our state level, to do something that is meaningful. I'm very, by the way, gratified that the Democrats in the Senate in this country are so galvanized about this that they're willing to stand there and say, we're not going to fund our government until you fix it. That's a good sign to me. That means that somebody actually is beginning to pay attention to what we're telling them. But as I said, the message has to go out. It has to be a coherent message. It needs to be delivered in a way that is intelligible for people. That's why the book, again, I made great pains. It was edited several times to make sure that it was understandable to the public so that they could understand the stories and the issues. But this is, again, begin the conversation that we need to have with the public about the importance of changing the system.
How? Yeah, because I'm trying to. What would be a way to galvanise the medical professionals to actually kind of stand together across, from border to border? How would you galvanise medical professionals, like you say, to say, right, you have to sort this out, or we're not coming into work on Monday. We're all going to go on strike for the day to bring the. How is there not? Because you all agree. It's just like, where do you get that shining light so that everybody can look in the same direction?
One of the ironies of all this, David, is that by the nature of our training and our mission, we will never let our patients down.
Yeah,
that's our mantra, right? And so to get healthcare professionals to do a job action or to say, well, we're just not going to take care of the patients anymore is absolutely impossible. So an example of this is our nurses. The nurses in this country are horribly underpaid, horribly underpaid. And every once in a while, at a hospital in our area, the nurses will go out on strike for a day. A hospital administration, everybody who's paying those nurses paltry fees know that they're going to come back the next day. So they just have to basically get through one day of pain and then everybody be back to work again. So they have used us against ourselves. So strikes, I don't think, are necessarily the way that this is going to happen. I think the way, again, it's going to happen is if we can convince all of us, ourselves and our patients, that this is important. And I'll tell you something, David. I am really pissed off at our professional organizations. The American Medical Association in this country has not stood up and made their voice known loudly enough. They have not galvanized their membership, and they take a tremendous amount of responsibility for just letting the status quo be the status quo, and that they have done literally nothing to make the situation any better. Now, how would they do that? I mean, doctors don't have as much money as lawyers to lobby. That's another problem. So the Trial Lawyers Association, for example, in this country is enormously strong and has blocked every move that's been made to try to fix our malpractice system. So there clearly are all kinds of roadblocks, but unless we get organized and again work with our patients to make changes, it's just not going to happen.
Okay. Just lastly, where can people find you and find your book?
So I'm on the usual outlets, Amazon and Barnes and Noble and those kinds of things. But if you want to get a lot of information about the book easily, it's just my name, Peter Kowey, author.com. There's a website, gives you all the information. There's some videos, links to other places that you can go look at articles and stuff. I'm doing a lot of op-eds and editorials that are in print that you can read. And the best part of the website is that you can leave comments and we respond to anybody's comments they have about what's going on and how we can make things better.
Perfect. And lastly, and a very big change of energy, because it's a random question I'd just like to ask. If I could just ask you for a second to just compose yourself, because it is a very different change of direction. I want you to imagine you have a time machine. The time machine is a car. What car would it be? Where would you go? And what would be playing on the radio?
Which car would I select?
Yeah.
My 1966 Oldsmobile Cutlass.
Nice.
That was the first car I ever had. And I would be playing the Rolling Stones, I Can't Get No Satisfaction. It was a song when I was 16 years old. I had my car. It was the first thing I turned on the radio. The Stones came on. By the way, we're insane Stones fans, so that's another issue.
Yeah.
But and where would I go?
Yeah, where would you go in history?
I would go back to the same period of time in the 50s and 60s, because medicine then was truly a profession. I mean, it was an honored profession. Doctors were admired. They worked hard. There were very few doctors who wouldn't make house calls. I remember our family doctor. He was a giant in my mind. He was God. He was godlike. He had no nurse in his office. He had no secretary. You didn't get an appointment. You just waited until the next appointment. He had 2 dogs in the waiting room that you could play with. So that made me happy. But when we went in to see him, he took care of everything. He gave us our shots. He took our blood pressure, whatever it was. He was a giant. And if I could take us back to that time when doctors truly were doctors, that would be terrific.
And that's a perfect place to stop. Thank you very much for your time. I have appreciated it.
David, it was a complete pleasure. Appreciate it, and hope to meet you again.
And that's Dr. Peter Kowey and his new book. One of the things that happens sometimes when I finish recording is obviously myself and the guest have a conversation. And sometimes the conversation is probably better than the podcast, if I'm being frank and honest. But Dr. Kowey mentioned something that was really interesting. is he remembers his first doctor. He remembers the doctor, the waiting room, the doctor visiting his mum when his mum was sick. And he was a child, and this doctor was like God. And that's the point. There were no secretaries, there were no waiting lists, there was no nothing. It was 1950s America, and you just went into the doctor's office and everybody just waited in their turn, and the doctor saw everybody. Medical care used to be about caring for people. And that's a somber note to finish on. As always, thank you very, very much for your support. Thank you very much for everybody that watches, shares, likes and comments. I do appreciate it. Wherever you're from, whatever you believe, please do take care and be blessed. Thank you.